Good morning. I'm Professor Avi Seidman. I have the pleasure of co-chairing this executive summit with Dr. Ray Dorsey. As we continue our exposition this morning, we recall that elder care delivery has been and still is a very labor-intensive activity. Many of us are looking for ways to deliver those services in a compassionate and a more affordable way. Our next speaker has created a novel way for addressing a big part of this concern. Therefore, it gives me a great pleasure to introduce our next keynote speaker, Mr. Seth Sternberg. Seth basically has been the co-founder and CEO of a company called Honor. Honor is an amazing startup that uses information technology to transform non-medical in-home care for Americans. Seth will speak to you for about 15 minutes, and then we'll try to follow it up with about 10 minutes of Q&A. Prior to establishing Honor, Seth has been involved with a company called Mibu, which has been a pioneering technology company in the domain of instant messaging and social networking services. This company has been later on bought by Google for the amazing sum of $100 million, and basically gave Seth the appetite to climb even a high mountain next. So it's a great pleasure. Stage is yours, Seth. Thank you very much.
Thanks for having me. Hey guys, so thanks for having me. I really appreciate it. So I was asked to speak about kind of why we're doing Honor and how we found about this problem, kind of maybe the entrepreneurial process of it. So I'm going to take you through a little bit of our story, and then hopefully leave time for questions at the end. So this is a picture of me graduating in high school, and that's my grandmother. And my grandmother passed on about a year after this photo was taken. So she got colon cancer, and it was discovered pretty late. And my grandmother lived in Great Neck, which is like right over there. I lived in central Connecticut in West Hartford, so it was like a 4-hour drive from my mom's home to my grandmother's home. And you know, my grandmother lived in this little home on Grace Avenue in Great Neck, and she lived alone, right? And she was kind of aging in place. We all know that term, but she was pretty isolated. And she wasn't very good at doing things like going to the doctor, right, or driving. She actually, even at this age, she was walking about a mile to the Great Neck LIRR station to come into Manhattan when she did. And then when she got colon cancer, they decided to operate on her, and at the same time she was starting to show some signs of dementia, so we're having some concern about that. And then really, after she had that operation, unfortunately her path of decline was pretty fast, right? And at some point, pretty quickly, she left her home, she was put into a nursing facility. And I still remember, I was reasonably young, I still remember that when she was in the nursing facility, she had a roommate. And I was thinking to myself, this really sucks. And not only did she have a roommate, but the roommate was hard of hearing, right, which my grandmother was not. And so the roommate had the TV on really loud, right? And my grandmother said, like, the TV is on really loud. And I thought to myself, this sucks even more. Like, who wants to be in a place with a roommate with the TV on too loud when you're probably a month away from passing on? And so then she ultimately did pass on, but that left a strong impression on me. Like, the entire process sucked end to end. And I think that we can do so much better. And so then, as I started to think about my mother as well. My mother lives in Connecticut still, and she's great right now. But I recently went home to Connecticut, flew into Bradley, and she picked me up and started driving me home. And as she was driving me home, she was driving a little bit slower. I was just like, Mom, why are you driving a little bit slower? And she said, well, Seth, because driving has become a little bit harder for me now. And that was really weird for me because my mother's the lead foot. Like, she got multiple speeding tickets in Connecticut when I was a kid. She was really good at racking. She even got caught by an airplane speeding ticket thing once. It was really impressive. So that got me on, oh, wow. Like, I saw this happen with my grandmother. And I am not going to be the son that has to say to my mom, hey, you've got to move out of your home because you can't be here anymore, Mom. Sorry. So basically, we're building Honor to solve that problem. I want my mother to stay in her home for absolutely as long as she wants to. And by the time she needs help, I'm sure, or I hope, that we will be in central Connecticut to help her. So as I started looking at that problem, I just said to myself, well, how do we help seniors stay in their homes? And I quickly discovered, as you probably all know, that this is not a problem for my family. It's kind of a problem for the world, right? And everybody knows, well, we've got this burgeoning senior population, right? And Italy, Japan, and Germany are inverted, right? So over 20% of their population is over the age of 65. Northern Europe is going to invert before America does, and then America is going to invert. So, my guess would be that everybody here knows that. But there are two other confounding factors that people don't think about when they think about the issues of how we're going to care for our elderly. So the first is shrinking families. So you used to have lots of kids, right? In developing countries, you had even more kids. In developed countries, you had less kids. But in general, you had lots of kids. And the thing about having lots of kids is that usually, like the fourth or fifth, like one of them hangs around to take care of you, right? But when you have like 1 or 2 kids or 1.8 kids, it's less likely that they're going to one of those 1.8 kids are going to hang around to take care of you. So that seems like a problem. But wait, there's more. Urbanization. So you cross less kids with that everyone's moving, the kids are moving to cities like this, or San Francisco where I live, where you pay a lot of money for a 500 square foot apartment. And you can't have your mom live with you anymore. And the thing is that's happening in America, but it's also happening in Paris, in France, and it's also happening in China. One-child policy, way less kids, and now the kids are moving to Shenzhen, Guangzhou, Beijing, Shanghai, right? And they're paying a lot of money for very small apartments. So even in China, it's kind of like, hey, can mom really live with me anymore? And the answer more and more is no. So that's a real issue we're facing. How do we take care of our seniors? How do we let them age with joy, with grace, and comfortably? And so you put all these together, it's pretty clear that we've got a global problem, right? It's something that we absolutely are going to have to face as a society in America and then in the world. And so honor, from looking at what's happening with my family and then extrapolating to the world, honor is meant to start addressing this. And then, of course, the question is, how are we going to do it? So I started looking at how we address this today, right? Like, I knew nothing about the senior space. I knew nothing about healthcare, really. And I just said, OK, I'm a smart guy. I've got some resources. How am I going to help my mom stay in her home? And so I found 2 things. I found devices, right? The slip and fall stuff, and rig your home with sensors. Put a sensor on your refrigerator door so that when your mom opens the refrigerator door, you'll know, right? The problem with those sensors, by the way, is if they fall off, right, of the refrigerator, who's going to put it back on? And then I found the services space, right? In-home care, non-medical, and in-home care, medical. Well, the devices stuff, to be honest, I didn't think was particularly awesome. I think it's the best example I can give of why it's not particularly awesome from a product perspective is, so if you guys ever, raise your hands, have you ever bought a product that's in one of those bonded plastic cases that you have to hack open with a hacksaw in order to get into? Raise your hand if you had that experience in life. OK, everyone. How many people in this room have arthritis in their hands? Probably very few of you right now. But when you hit 75 or 80, you might. So how is someone with arthritis in their hands supposed to open a bonded plastic case that none of us can open, right? But that's what these products are sent in to seniors. So that's not great. But that's not where we decided to start in terms of fixing this problem, because then we saw the services side. And we looked at the non-medical side of in-home care. It's really interesting, because it's where healthcare kind of stops, right? And at some level, professionalism stops. And it's where kind of rest of world begins, except it's where a lot of things go wrong. And it's definitely where things went wrong for my grandmother when no one was there to say, hey, don't forget you have to go to the doctor, or even to help her get to the train station or to the doctor's office, because she wasn't, she didn't feel safe driving any longer. So as we dove then into non-medical in-home care, right, as we kind of discovered, ooh, this doesn't look very good, we found some pretty scary stuff. So the first thing we discovered is that people in non-medical in-home care, and by this, just to be clear, I'm talking about the folks that go into a home and help seniors with activities of daily living, right? So getting out of bed, getting dressed, bathing, right? Getting food, companionship, right? So the basics of helping someone stay in their home as they have trouble doing day-to-day activities. So the first thing that shocked me was that anyone that we're sending into the home is paid extremely poorly. I've got a chart later on this, but on average, they're paid $9.50 an hour. On average, in theory, they get 34 hours of work a week. It's really, I think, like our math says, it's more like 20 hours of work a week. So could anyone in this room imagine living on $9.50 an hour and 20 hours of work a week, right? Half-time job, you'd be on welfare. And turns out 56% of in-home care aides are on welfare. That seems like they'd be in a tough position to take care of our parents well, right? If we're treating them so poorly, how are they going to treat our parents well? And then, the matching is terrible. So, you talk to these in-home care aides, and which we did. We actually intentionally did it not in Silicon Valley because, as I'm sure you guys probably all know, Silicon Valley is this very strange bubble that's really weird, right? So we're like, let's leave Silicon Valley and go to Sacramento, go to Phoenix, and talk to people there. And so what we heard is, I'm sent into a home, and I have no idea what's behind the door. Like, I knock and I get in, and I'm a 90-pound female, for example, and there's a 300-pound male, and I'm supposed to help him out of bed. But I'm not capable of that. Or I'm really allergic to cats, but I keep getting sent to homes that have cats. So this happens all the time. So the matching between the capabilities of the the needs of the seniors and the capabilities of the care pros is very bad. And as I said, they get no information. And then finally, if you think about an underlying product to kind of take care of this system, right? At the very least, you would want electronic records, right? At the very least, when care professionals do something in a home, you would hope they're able to record it and then pass it on to the next person. And today they do record it, but they record it on a spiral-bound notebook that they leave on the kitchen table, literally. They leave it on the kitchen table for the next person to come and get. So this looked like a really scary world to me, and I was certainly not going to entrust my mother to this system. And so that's where we will begin. So, like I said, or as Avi mentioned, I started a company called Meebo. Meebo grew to 200 people. Google bought it 3 years ago. And I kind of discovered this while I was at Google and started looking around for how, what is the solution, right? Like, what is the product that we're going to build to fundamentally address this problem? And I ran into this interesting thing as I started looking at how you would put the company together, right? From a Silicon Valley perspective, it's kind of okay, I've got this really big problem. How do you amass the right resources to tackle this problem? I discovered something really interesting, which is that VCs almost never invest in the senior space, right? Forget about Silicon Valley. In New York, it's the same problem, right? In Austin, Boston, they don't really invest in the senior space. When they do, the dollars are really small. It's like, here's $2 million. Go try to solve a big world problem. It's very hard to solve big world problems on $2 million, especially ones that are as complex as the one we're all talking about right now. And I think there are a few reasons that VCs don't invest. I'll put one of them up here. I'll talk you through a couple of other ones. This is the obvious one, right? So the prevailing belief is that innovation comes from technology, which I think is largely true these days. But then the belief is that, and seniors do not use technology. Therefore, it's a very risky investment as a VC, right? Why would you invest in a tech thing for seniors when you're too scared that seniors won't use tech? And I think that that's a completely incorrect point of view on technology. And my proof point is the automobile. Lots and lots of seniors drive cars. I am not capable of building a car. I'm not Elon Musk, right? Elon Musk can build a car, but that is deep tech. But seniors use them all day long, right? So if you think about technology as just a means to a service, kind of like a microwave or a toaster oven, that's really what technology should be for everybody, right? And all of a sudden, you can just scratch that out, right? Because it turns out that technology can enable any given service, and it shouldn't be that when you're using technology, you feel like you're using technology. And I think that's really an important design point. The other couple of reasons that we ran into as we were looking at why VCs just are crappy in investing in the senior space. So one is we have a problem with the entrepreneurs. So this is a little known stat, but you can look it up. Entrepreneurs tend to be from the upper middle class. I was, and so why? Well, it turns out that the very wealthy kids, right, when they grow up very wealthy, they're not hungry enough, right? And the not as wealthy kids are too worried that if their company fails, they won't have food on the table. But if you grow up upper middle class, you're still hungry, but you know mommy and daddy will take care of you if you fail. So if mommy and daddy are your backup, right, who are you not going to build for? Your backup, right? Because you build for your problems, but your mother and father are your solution, right? So therefore, the senior space is kind of one of the last things that you think about. So that's another reason why you see it. And then the final one is you've probably all heard the term VCs are lemmings. I don't know if people have heard this, right? There's this notion that VCs tend to invest in what other VCs invest in. Largely that's true. It's not always true, but it's largely true. And there have not been big VC investments into the senior space. And there have not been big exits in the senior space. And so that makes it, from a pattern matching perspective, scary. So what I did is I went to someone who'd invested in Meebo, Mark Andreessen. And Mark, if you guys don't know him, he's the guy who did Mosaic, which became Netscape. He really is kind of the guy who can lay claim to, I created the web. He didn't quite create it, but he created the web browser. And he is kind of the reason for the web that we all use today. And I said to Mark, hey, dude, like, my mom, I want her to be able to stay in her home. We have, like, end to end, we have to completely rebuild the system for helping her stay in her home on the non-medical side. And I started getting 2 a.m. emails from him every night. There's always a 2 a.m. It was like the Mark 2 a.m. email with another idea. And so then Mark ended up investing $15 million out of his VC fund, Andreessen Horowitz. And then I went to a bunch of other people across kind of not just Silicon Valley, but folks like Bob Carey, who will be here later today, or Laszlo runs HR at Google, right? Because think about the employees at Google and then the issues that they face with their parents and losing time and attention at work, or Ben, who ran the NAACP for 4 years, right? So I went to a bunch of people who I felt like could really help us solve this problem in some meaningful way because of something they did in life. Andy runs life sciences at Google, right? I said, hey guys, come in next to Mark. So we raised another $5 million from people across Silicon Valley who I thought could really help us. And then with that, we formed Honor, initially with 10 people and now probably with 25 people. So our solution to the problem is you really think about 3 actors in the space, right? So you've got the senior, but then the senior is supported by the care professionals and by their family. And I think that if you don't put the care professionals and the family in a good place, right, then it's very hard to support the senior. So I think everybody, if your guiding light is how do I give amazing care to the senior, then the question is who else needs to be supported, right? And I think you discover that it's the care pro and the family. And like I said, the care professionals are not well supported today. So this is actually one of the first problems that we have to figure out how to solve. Personal care aides are the #1 job category who come from families where their family income is at 200% of or below the poverty level, right? The biggest one. And then it's home health aides right after personal care aides. That is a really scary statistic. These are the people who are supposed to help support our seniors, but we are leaving them in a terrible place in their lives. And so what we're doing for them is the first thing is, like I said, their average pay in America is $9.50 an hour. In the Bay Area, it's $12 an hour. And on Honor's platform, they start at $17 an hour. And when you're moving from $10 or $12 an hour to $17 an hour, that's transformational, right? And if you think about what else that does for the senior, right? So if they're making $17 an hour, they're in a much better psychological state when they walk into the senior's home, right? They are more prepared as people to take care of the seniors. And it lets us have the pick of the best people, right? So only 5% of people who've been applying to get onto Honor's platform for us to then bring them to seniors' homes are actually accepted. And we do things in screening. We do the obvious stuff, like let's run background checks and all that. But we actually hand them a cell phone. Like literally, when they come in for screening, they get handed a cell phone. It's like, there's a quiz on here. Find the quiz and take it, right? And that checks for not only do they have knowledge of, it's basically a CNA exam, Certified Nursing Assistants exam, but it also checks for if they can take it on a cell phone, which some people can't. When we showed the care professionals where to go in the app to set their schedules for when they wanted to work, because remember, a lot of these folks are single moms, their minds were blown. They're like, wait, we get to set our own schedules? And we were like, yes, you do. And then we showed them the button that they can hit when they're sick. We were like, when you are sick, this is the button you hit. And then we'll automatically backfill you with the next best match for the senior. And they're like, wait, there's a button we can hit when we're sick? I'm like, yes, there is. And they're like, that's amazing. And I was like, this is weird, right? Why are you so amazed? And so I asked them, like, why are you so amazed that there's a sick button? Like, didn't you just used to call an 800 number and say, hi, I'm sick, I can't go today? And they're like, no, we never got to say we were sick. I was like, what do you mean you didn't get to say you were sick? I said, well, our agencies were too small, so when we were sick, we still had to go to work. And I was like, so you went to work sick into the home of a senior with a vulnerable immune system? Like, yeah. And then I started asking around, and people said, yeah, like my dad got a lung infection from a sick care pro that went to their home. It's like, oh my God. So let's solve that, right? And so they're handed an app. That's just one screenshot from the app. And of course, the app does stuff like lets them, accept job requests or say, no, I don't want to do that. It gives them lots of client information. So it tells them not just about the physical aspects of that person they're going to go work with, but also the kind of like what did they do in life? What was their career? What's their proudest moment, so they can know them as a real person. And it also looks at stuff, I'm going to skip it for now, around fraud and abuse, making sure they arrive on time, leave on time, weren't surfing Facebook when they were in the home, et cetera. For the families, so let's talk about propping up the families of the senior. So if I had someone going to my mom's home in Connecticut and I live in California, I'm basically in the dark, right? I have no idea if my mother's getting amazing care. I don't even necessarily know if the person's showing up, right? So what we've done is we've built an app for the families, for the kids. I get to be a kid even with as much gray hair as I have in this space, which is kind of cool. And it shows me, this is the person who went to your mom's home. This is how long they stayed there. This is what they did when they were in your mom's home, right? So I get information. I can hit a button. It's not on here, but if I tapped in, I can hit a button and say call them or text them, right? So now I'm in the communications loop. And in fact, if I hit that share photo button, then that photo goes over to a touch screen that's in my mom's home. So for the seniors, we actually put a touch screen in their homes. And it's very, very simple. There's no need to use apps. There's no need to swipe on anything. And basically, it shows photos that I've just taken of my son or whatnot that just appear on that screen across the country, which is cool because my mom now gets to see the photos without having to log into some service or something. But then when it has something to say like, hey, your care pro is going to be there at 10, it says it, right? And if Viviana's sick today, it'll say, oh, Viviana's sick, but Mary's coming, right? And then when Mary leaves, it'll say, hey, Mary just left your house. How'd she do today? Thumbs up, thumbs down. So that we can start getting proactive information about the care that from the point of view of the senior, which we also, of course, ask the kids and everyone else. So that's fundamentally the solution that we're building. This stuff, I'm just going to close really fast. Everybody concentrates on the physical needs of seniors today. And I think if you look at my grandmother or seniors in general, isolation is actually probably the #1 problem, right? Aging in place is not that good if it means you're stuck in your home and you become separated from society, right? And that leads to depression, that leads to hospitalization. So that's something that I desperately want us to address, and we will with a bunch of product stuff that we're going to do, specifically work on the isolation problem. And then really think about, as I like to say, kind of the whole human. And I think that if honor had been there for my grandmother, right, and it will be there for my mother, then a lot of the problems that she faced at the end of her life wouldn't have happened, right? Or they would have at least happened much later. She wouldn't have been isolated in her home. She would have had someone there saying, hey, you should make sure that you go to your regular doctor's appointments. We wouldn't have discovered that she had dementia as late as we did when she came to our home in Connecticut and brought her brown paper bag of important things, and there was a lid to a pot in that bag, right? That's how we figured out that she really had dementia. We would have found all that earlier because we would have had someone going to her home just for an hour a week, checking up on her and making sure she's doing okay, make sure she can still reach her feet to note she's not a fall risk, right, and getting her out into the community. So that's what we're building at Honor, and that's kind of our story. And any questions you have, feel free to go.
Thank you very much, Seth. We'll have 10 minutes for Q&A, please, on this superbly creative Honor application. Please. Can you speak to the microphone, ma'am?
Sure. The question was who reimburses for in-home care. So non-medical in-home care, like I said, this is where kind of medicine stops and the rest of the world begins. So Medicare does not reimburse for non-medical in-home care. What's amazing is non-medical in-home care on the kind of really bad product that it is today is a $20 to $30 billion industry in America. The industry doesn't know a lot about itself, but the estimates are that between 50 and 70% of the total payment of those $20 to $30 billion are private pay. The remainder comes from either Medicaid. So if your assets have been spent down and you're in Medicaid, then you can get some, and it depends state by state now, but you can get some level of reimbursement for non-medical in-home care, or long-term care insurance, which only about 15% of people have. So the net is it's really private pay. The average billing rate, like in the San Francisco Bay Area, for example, is $26 an hour. So you should be now thinking to yourself, wow, if you can afford $26 an hour, that's great. Or if you're on Medicaid, you can, if you have a bunch of assets, or if you don't, you can afford non-medical in-home care. But what about the middle? Because as usual, the middle's squeezed in this area. I won't go into the details, but that is something I desperately want to address in time. Because we're bringing scale and tech to this, we can bring a lot of efficiency. And just to be clear, I don't want people to feel like they're using technology when they're using Honor. Like the tech sits in the background, right? And it just enables an amazing service for seniors and the care professionals and their families. But I think we can do a lot to reduce cost over time. And part of it, not surprisingly, is doing smart things like I think that we should be able to reduce kind of hospitalization and readmission if we do our jobs right in time.
Yeah, Seth.
Oh, yeah, sure.
So could you say a little bit more about the economics, and in particular, if you can pay your these employees, you're not like Uber where you're sort of washing your hands at these people, but how do you actually make the economics work if you pay them much higher than the prevailing rate? But presumably, do you collect more for the service, or are you making that up later? And sort of related to that is, then what's the when someone like Mark Andreessen invests in this, is he doing this out of the goodness of his heart, or you actually make a case that you get venture scale returns on the?
Yeah, sure. So in terms of the structuring, they're actually 1099s, so they're running their own businesses. There's a lot of reasons we chose to go with that model. We looked hard at 1099 versus W-2. And we think that we can provide a better service for the seniors by giving the care professionals a lot of flexibility, set their own schedules, be sick whenever they want to, et cetera, and also be able to pay them dramatically more, right? And then they're able to choose for themselves what other services they buy with that extra money that they now have. In terms of how the economics work and why we're able to pay so much more, because actually 17 to me is where we start. Like I want to be able to float that up. And if you think about, so you mentioned Uber and Lyft. So Uber and Lyft have this problem that for any incremental driver, they don't add value to you as long as a car can get there in 2 minutes, right? Like you don't care if the next driver has a PhD or is a high school dropout. If they're good at driving a car, you're fine. That's why there's downward pressure on the wages for the drivers of Uber and Lyft. In this case, if you think about a senior who only speaks Mandarin, has dementia, and has cats in the house, a care professional who speaks Mandarin, has dementia training, and is not allergic to cats is actually a very valuable individual, right? And they help us serve one incremental person, which actually keeps upward kind of pressure on the value of that person and then their wages. We can take a much lower spread of the kind of revenue. Right now, the industry takes over 55% of the kind of revenue they charge and then what they pay out. We can take a much thinner spread because scale. Like instead of having someone have to drive an hour to home, it's like 10 minutes, right, at scale, or 5 minutes. A lot of things that are done manually today, we won't do manually, we'll do it automatically. Like we hired one of the people who was a scheduler in an agency who literally like knew in her head, and this is the way the agencies work today. She knows like here are the needs of the seniors, here are the capabilities of the care pros. She's doing human matching, and then when someone's sick, they literally call down a phone tree. It's really scary, right? That all will become a computer, right? And we hired her to understand the way the system works today, but like that will become a computer, right? And then also, at scale, a lot of kind of one-off expenses that you have that you can only spread across, say, 30 care professionals. The average agency, there are 50,000 agencies across America that do in-home care today. They're all mom and pop. It's the way this industry currently works. They, on an average, only have 30 care pros. So it's very little revenue to spread a lot of cost over. And our dynamic will obviously be very different at scale. And then Mark Andreessen, so he invests for two things. In Mark's world, he got excited about Honor because it can change the world, right, for 3 people, right? The same reason I got excited about it. It can change the world for seniors. It can change the world for care professionals. It can change the world for the kids, which is a lot of people, right? 40 million people self-report caring for the elderly in America trailing 3 months, right? At the same time, the belief is that it can be an amazing economic outcome because the problem is so large. And hey, seniors spend $1 trillion a year. People over the age of 65 in America spend $1 trillion a year. It is a supermassive market, one that's been largely ignored, right, by the investment community, but a supermassive market. So there's a lot of opportunity in there.
Hi, John Holland from AMC Health, and since there's no line, I've got 3 questions. Are you using video visits?
That's one of the things that we've thought about for, we would embed other people onto our touchscreen in the home. So we won't build like a video to doctor system ourselves, but that screen in the home would give us the opportunity to let something else be there to connect folks with doctors.
Inability to manage complex polypharmacy is one of the major reasons people go into nursing homes. Are you addressing that?
Not in V1. So one thing that's important about, in terms of the kind of complex version of what you're asking. So one thing that's risky, and just to out this for everybody, so we have the classic kind of second-time entrepreneur risk of we're able to raise a fair amount of money and therefore get a lot of resource. And you would think that therefore we can do everything. And if we do that, we will die. There's no doubt, right? We will not succeed, and then we will have failed the seniors. So we're staying very, very focused. And in V1, it's let's serve the kind of clear physical needs of the seniors better. And I think we can do that at much higher quality, lower cost, more efficiency, much better match between the capabilities of the Care Pro and the needs of the senior, and keeping the kids in the light while we pay the care professionals much better. That's an order of magnitude improvement over where the world is today. I have 14 scripts. How do I manage these all? Do they conflict? You know, this doctor gave me that. Absolutely, it's a huge problem. I desperately want to get to that. I'm sure we will end up partnering with someone to kind of put that into the overall system, but it's not something that we can handle if you want.
You said you're pretty confident that you'll reduce hospital admissions.
That's where I want to get to, yeah.
Do you have any strategy for connecting to the people who will benefit from that? Like, hospitals will benefit if you reduce 30-day readmissions. Medicare will benefit, insurers will benefit, but they're not paying for this. How are you going to link that?
So to be clear, that is something that I feel like over time we clearly can get to. We've been talking to a lot of providers, payers, bundlers, you name them, we're talking to them to understand what they believe we can actually do. When you have a human in the home that has a supercomputer in their pocket, you're limitless in terms of what you are able to accomplish inside that home, right? And the data that you can collect, and then how you can look for signal from noise from that data, and then figure out where you kind of have issues to address or not. So we are absolutely thinking about it. This is stuff that it is a little bit more future, but I think it's not overly difficult for us to get to, and you know,
cool. Thank you.
Too long. No problem.
Okay, time for last question. Can we put a minute or so?
I think it's a quick question, Seth. 2 parts. First off, the delta between the price that you're charging and what the market is now. What is, from the purchaser's perspective, what's the value proposition that they were willing to pay that difference? And the second part of that, who do you see as a primary person? Is it the senior at home? Is it the loved one? Who is paying for it?
Yep. So the quick answer is, because I know we're out of time. So we effectively come in either slightly above market or slightly below market if you buy hours in advance. So you can actually choose to get us cheaper than market today, at $25 an hour versus $26, if you buy hours in advance, or slightly above market. And then obviously the value that you're getting if you choose the above market thing, which is fine, is just the simple, like, I have an app that shows me who went to my mom's home, right? What they did when they were in the home. I get a note every day, right? Anytime someone comes in, you get a personalized note that says, you know, oh, your mom's doing well today, or her friend, you know, Enda came over, or, you know, she's getting over her cold, right? That, to me, like that, you know, kind of window into my mother's world, I'd pay almost anything for that. But, you know, at our highest tier pricing, it's only $2 more an hour than what is currently charged. Of course, you can get us below what's average. And then to your second question, which was, sorry, just
who's going to pay the
yeah. So we see the senior they are the guiding light, right? Everything is built around how do we make the senior's life substantially better, and like I said, let them age with kind of joy, comfort, and grace. The payer is usually their kids, right? It's usually a daughter, daughter-in-law, son, son-in-law. So they're kind of the person paying, but not the person we're actually designing the overall service for. But then the kids benefit because I think to provide amazing care for the seniors, you have to take great care of the kids too.
Thank you.
Cool. Thank you guys.
Thank you very much.
Appreciate it.
Amazing presentation. It's time now to go for a quick coffee break. And before we go, I would like to recognize Peter Tippett and Nancy Green from Verizon Enterprise Solutions for all the generous support. Let's go enjoy the beauty of the landscape, and the coffee break will be back at 10:45. Thank you very much.